Professor Takemi, distinguished guests on the podium, and distinguished participants, ladies and gentlemen, let me first and foremost thank the Japanese government for hosting this event, and of course, to thank Prime Minister Abe for gracing the occasion. Japan is indeed a most appropriate venue for this meeting. This country has long promoted universal health coverage as part of its strategy for global health diplomacy. And that strategy will again receive prominence when Japan hosts its next year's G7 summit, and of course, very importantly, the Ticket 6 in Africa. As the year comes to an end, we face an important moment in history. Ladies and gentlemen, after decades of neglect, the world is finally focused on the need for equitable, inclusive, and resilient health systems that can withstand shocks, whether these are caused by a changing climate, a natural disaster, or a runaway virus. I thank Prime Minister Abe for his latest Lancet article, making a very, very strong statement on the importance of health for human security and for a peaceful world. The Ebola outbreak in West Africa dramatically demonstrated that, a runaway lethal virus, once it gets a firm foothold in the country with weak health systems, can truly get out of control and affect the whole world. The absence of a sensitive surveillance system with laboratory support allowed the virus to circulate undetected off every radar screen for 3 months. Let me remind you, the first core capacity set out in the International Health Regulation is an ability, and let me quote, to detect events involving disease or death above levels for the particular time and place in all areas within the country. Guinea, Liberia, and Sierra Leone, they had programs for HIV, TB, malaria, maternal and child health, as well as for the neglected tropical diseases. But they did not have the IHR core capacity to prevent, detect, and respond to unusual disease event. In a Lancet editorial in 2013, again by Prime Minister Abe, he talked about the glorious day of MDGs, but he added a very important warning. He said, if the world follows the existing disease-focused vertical pathway for development assistance in the coming years, the disparity between resource allocation and actual disease burdens will widen, end of quote. Fortunately, ladies and gentlemen, the world changed course, and I thank Prime Minister Abe for his warning, along with that of WHO. The inclusion of universal health coverage as a target under the health goal for sustainable development expresses the very spirit of the new agenda, with its emphasis on poverty alleviation, equity, and social inclusion that leaves no one behind. UHC, based on primary health care, serves the health goal really well as a unifying concept, a platform for the integrated delivery of health services, and one of the most powerful social equalizers among all policy options. It is the ultimate expression of fairness. People who cannot pay for health care are not left to stay sick, get sicker, or die of a preventable or treatable condition. It contributes to efficiency. Schemes for financial protection encourage people to seek care early when the prospects of successful treatment are greater and the costs much lower. UHC is a desirable outcome in its own right, a foundation for reaching other health goals, and a reliable measure of how well sustainable development is progressing. On that, let me welcome the Bill and Melinda Gates Foundation's initiative called Vital Signs, which has stimulated further discussions and action on how to improve data systems in country, as well as to measure performance of primary health care. In short, ladies and gentlemen, UHC is a pro-poor strategy for sustainable development that has great and growing appeal. Since 2010, more than 100 countries have approached WHO seeking support in reforming their health systems toward UHC. This tells us that UHC is the most powerful concept that public health has to offer. Ladies and gentlemen, the challenge now before us is implementation. As you will be exploring during this conference, UHC cannot provide access to all health services. Resources in every country fall short of what is required to meet all needs, especially as the costs of new medicines and technologies continue to rise. In other words, priorities must be set and choices must be made. Making fair choices is challenging, but fully worth the effort. The evidence is now overwhelming. Providing quality health services, free at the point of delivery, helps end poverty, boosts economic growth, and saves lives. I wish you every success during a conference that is certain to be uplifting. The political will to achieve UHC is here. It is our job, friends, colleagues, it is our job to eliminate the pathway to that goal. Thank you.